Hi guys, this is your spinal anatomy lab. It is week 6. We are starting the thoracic spine, and you're gonna have to watch this one. I forgot my equipment to do this live. I had to pre-record it this morning, so sorry about that. So watch it at your leisure. Here we go, thoracic spine. Let me grab something here. Okay, so let me turn this too so I can see it a little bit better. Okay, great. So we've been working on this thing. So this is a lumbar vertebrae, and you can tell it's a lumbar vertebrae because it's quite large. Transverse processes, they jut pretty much out perpendicularly to the body. And then the spinous process is straight out the back. If we turn it to the side, we can see the spinous process pretty much jut straight out the back as well. Now compare that with this bone. This is overhead. It's smaller. Transverse processes jut straight backwards. They're also club-like. They're said to be club-like. And if we turn it to the side, I hold the body here, you can see the spinous process is not quite vertical, but pretty close to vertical. So that is a classic thoracic vertebrae. Plus, let me try to, I don't know if my camera will be able to capture this, but let's try to move it up. Plus, there are some facets on this thing. Hopefully you can see that okay. There's a facet right here. So that's called the costal transverse facet. And there's also a facet here, and there's a facet here. You can't see them quite as good unless you're really up close to them. Superior and inferior costal demifacets, and those are where the ribs connect. But the easiest way to tell it's a thoracic vertebrae is just to look on the transverse process, and there's a nice facet right there. All right, so let's go over the parts. This is kind of small, so let's use a picture. So let me reset things here for a picture. And that looks pretty good. You can see the spinous process, how it's jutting downward. And now we can see these 3 facets. So there's this is up, this is down. So superior bony implate, inferior bony implate, just vertebral body in general. This is the pedicle. What's this called? Notch. Which notch? Superior or inferior? Well, it's on the inferior part of the vertebrae, a vertebra. So it's the inferior vertebral notch here, forms the intervertebral foramen or half of the intervertebral foramen. We have a superior articular process, an inferior articular process, the spinous process, and now we have these facets. So again, we have the superior and inferior costal, meaning rib, demifacets. Superior costal demifacet, inferior costal demifacet, transverse costal facet, right? And those are for connections of the rib. If I throw a overhead look, or let me grab this kind of oblique look here. Let's put this in here. Now we can see how the rib comes in and connects to the 2 bones. So we can call that, let's call it T7 and T8. So the important note about this is the boards, and I always like to ask which rib is connected to which vertebrae. If this is T7, if this is T8, who is this? What rib is that? And you always use this superior costal demifacet to name the rib. If this is T8, this takes the same number, so this is the T8 rib. I always remember superior for same, S for same. So that's the T8 superior costal demifacet. So whatever rib is connected to that, it's the same, it's the T8 rib, and that's the T8 rib. You can see the see-through costal transverse facet here, or transverse costal facet. You can say that either way. And that's also the same number, because that's the T8, if this is T8, that's the T8 costal transverse facet, And that also connects to the same number rib. So those are two ways you can identify the rib. That, of course, is the inferior, the T8 inferior costal demifacet there. See how that works? We might as well hit this ligament while we're here. So it runs from the rib to the transverse process. So take a wild guess what it's called. Costal transverse ligament. We have to be a little more specific because there's two of them. There's one that's deep underneath this rib, connecting this rib to the transverse process underneath it. Can't see that one. That's the costal transverse ligament. This one runs superiorly, so it's called the superior costal transverse ligament. Right? So those are always important not to mess those up. If we look at an overhead view, now we can see if this is T8, there's the T8 rib, there's the superior costal demifacet of T8, so that has to be the T8 rib. There's the costal transverse facet of T8, so that's got to be the T8 rib. But now we can see there's a ligament. There's actually two bands of the ligament running between the rib and the transverse process, so that's costal transverse ligament, not superior. There's another one that's more lateral out here. Take a wild guess what that one's called. Let's see, can we barely, yeah, we can see that, okay. Kind of off the edge of the paper here. Let me pull that more in the middle. I guess pull that up, there we go. So that's, well, it's got to be costal transverse, and it's lateral. So that's the lateral costal transverse ligament. So those are three important ligaments. All right, and I think that's all I wanted to say about that. Let's actually look at a rib a little bit more now. So let's get a copy of a rib in here. I'm going to have to zoom out a little on this for right now. There we go. So this is a rib. So the first question is, and here's a real rib. I can throw that in here. Here's a real rib. How do you know, first of all, which way's up and which way's down? There's a groove right here, a little notch in the rib called the costal groove. That always is down or inferior. I don't know if we'll be able to see it that well here. Let's see if we can focus on this. There it is right there. I'll try to zoom in on it. You can see it? So what's important about that? If this is down, the nerve, artery, and vein run in a specific pattern here. The nerve is always the lowest one. So the the intercostal nerve would be on the bottom. In the middle would be the artery, and on the top would be the vein. So nave. Or van if you go superior to inferior. Vein, artery, nerve is on the bottom. When you put a chest tube in medical school, you don't want to put the tube hugging the bottom of this rib. You could damage the intercostal nerve and cause chronic pain and some muscle dysfunction. So you always put the chest tube up here on the superior part of a rib so there's no neural structures. You have less chance of damaging that way. So this is down, this is up. This whole thing is called the rib shaft up until this point right here. This point, and now let me maybe zoom in a little more. This point right here, that's the rib tubercle, the rib tubercle. This is the neck of the rib, and this is the head of the rib. And we have some structures on these. On the head of the rib, there's a facet. There's a superior articular facet of the rib head and an inferior articular facet of the rib head. And then there's a crest running between those. So that's the crest of the rib head, superior facet or superior articular facet of the rib head, inferior articular facet of the rib head is down here. The neck is just the neck. There's some ligaments that connect to that. And then the tubercle, we also have a nice facet. That actually matches up with the costal transverse facet. right? These match up with the demifacets. See how that works? So this is the facet for the rib tubercle, and there's actually a bump right here where a ligament attach. That's just, you could call it the tubercle of the rib, which is kind of weird. Tubercle of the rib, or tubercle of the rib tubercle, right? The other concept, and the last concept, is as you move toward the sternum, of course, this is connected posteriorly to the vertebrae. This is connected to the sternum. The rib gets more flat here. This would connect not directly to the sternum. Am I off the page? I think I'm off the page. So see how it gets more flat here? This would connect to costal cartilage. The costal cartilage is what connects to the sternum of the rib. The bony rib does not connect to the sternum. We'll look at the sternum more next time, right? And the last concept is the angle of the rib. If you're going to fracture a rib, most of the time it happens at the angle of the rib. And let's take a look at this one. So here's the shaft. Actually, we're upside down. That's, no, there's the costal groove right here. So this is correct anatomical position. This would connect to a vertebrae, like that. That's how it connects, like that. And see where it bends like crazy? If I had 3 hands, it'd be perfect. But see right here, it bends like crazy? That's called the angle of the rib. If you're going to fracture a rib, that's probably where the fracture is going to be. So you always, when you're learning to read x-rays, you always look at this area very carefully for fractures. Okay, so that's pretty much it with the rib. We got the bones covered. The rest of the bone parts, you know, there's a lamina here. I think I forgot to mention the lamina. Oh, the other thing I forgot to mention, if I bring it in close here, which way, is this up or down? How do we tell that this is the superior part right here? Because these facets, and again, I don't know if the camera's going to do this justice, but these are very smooth-looking facets. The facets of the superior articular process, they always face backwards. If I flip it like this, see those? Those are the facets of the inferior articular process. They always face forward. It's very important that you know which facets these are, because I could put a picture like this, and I don't know if the focal length is going to be good enough for that. But you'd have to know, are those the superior or inferior facets of the articular processes? So those, the inferiors face forward. The superior ones face backwards. All right, let's hit some more ligaments, and we're just about done. And I think this is on your worksheet exactly. So let's go over this. I think I need to back out just a hair to see this better. All right, so let's take a look at this. Anterior longitudinal ligament, of course. Superior, inferior costal demifacets, transverse facet, or costal transverse facet here. Here's the lateral. It's been cut, but that's the lateral costal transverse ligament. And again, this one's running from rib to transverse process. So that's the superior costal transverse ligament. The costal transverse ligament is deep underneath this rib. We can't see it. Here's a ligament running between the 2 transverse processes. Okay, so that's intertransverse ligament. If this is T7, what disc is that? It's the annulus fibrosus of the disc. T7, the bone that sits on the disc conquers it. And then we have one more ligament. And this one kind of radiates out. So take a wild guess what it's called. The radiate ligament. Radiate ligament. All right, so that's the ligaments. There's a couple more we'll look at in lecture, but I think for lab that's good enough. And I believe I have gotten everything. I've covered everything that I need to cover. So sorry I can't do this one live today, but email me any questions you may have, and we do go over this again in lecture, so you get a chance to see it live there. All right, see you later.